Please buckle your seatbelts because the scale of flight is taking off now.
Hello, everybody. How are you all doing? I hope everybody is doing fine. My name is Peeyush Upadhyay, and as you know, I'm the host of this podcast that we call the Scale Up Flight, in which we share some intriguing and inspiring scale-up stories. Today, we have another such fascinating story that we are going to be sharing with you. And I'm so privileged and excited to have with me here the co-founder and chief operating officer of Innovator, Sandy Gupta. Sandy, welcome to the show. How are you doing?
Peeyush, I'm doing good. And thanks for bringing me on the show. Happy to be here.
Exciting. Absolutely exciting. The weather, in fact, makes it better, right? That sets the tone of the show. I mean, it's just beautiful, sunny outside.
It's a beautiful day in San Francisco today. So yeah, can't be complaining.
I guess the only thing, if we want to complain and if we want to complain about it, is the parking, right? I mean, parking is a nightmare.
If parking got easier in San Francisco, then probably you are back to COVID times. So that's how I would think about it. But this is good for the local businesses as well, business as usual.
Like
because the streets are brimming and like this is how you want it to be.
This is exactly what it is. And otherwise, the place loses its charm and identity, right?
Absolutely.
Okay. All right. Wonderful. So, Sandy, thank you so much for being on the show. As I was just saying, here we talk about how founders, have built some incredible companies and enterprises and talk about their story of where they are, what the vision is, and what the vision forward is. So let's dive into it straight away. Everybody who's listening, knows, I'm pretty sure, that Innovator is the largest intelligent healthcare cloud. That's how you describe it, is it?
Yeah.
And
healthcare intelligence cloud or intelligent healthcare cloud. Yeah, it's configuration. Yes, yeah. Healthcare intelligence cloud.
Yeah,
but yeah.
Healthcare intelligence cloud. Okay, terrific. And there are three parts to it, right? I mean, one is your data platform, right? The other is Sarah, and I, in fact, checked Sarah out, watched a number of videos. I think it's super powerful, right? What it can do. So Sarah is the virtual AI assistant. Is that what it is?
Yeah. So Sarah, the name came in from a short form of goddess Saraswati, if you think about it. So Saraswati is like the goddess or of wisdom, if you will.
Right.
So our Gen Z version was that, okay, the Sarah layer is what, because you have the data, but you need to have the intelligence or the wisdom on top of it.
Right.
That's where the Sarah layer comes in. And then there are a bunch of applications on top, which give the downstream kind of, call it the agents or different kind of workflows for the end user. So yeah.
I just love the way as to how you've incorporated something from the East, right?
Yeah.
Something from the Indian culture, which is where you come from. And then, from the West as well, like making it a household name and something so relatable. So good on you for that.
Yeah.
So Sarah is the AI co-pilot or the virtual assistant.
Absolutely. Yeah.
And the third is what you call as the agents of care. That is your AI agents that could do, the pre-call screening, the intake calls, prior authorizations, benefit verifications. There are probably 10 of those that you've already built out.
And that list keeps increasing because see, like the way that I think about this is that there used to be an application layer or the software layer for the humans to work on. Now it's just that these agents of care are helping with the humans in the loop to deliver that outcome for the customer.
Got it.
So that's just the nuance over it. So you get the data, you get the intelligence, and then you get the agents of care delivering those outcomes for your end customer.
And you've built all the guardrails and everything around it just so that...
Absolutely. That's the reason why you always also want a human in the loop so that everything, because you're talking about healthcare at the end of the day.
So any hallucination or anything, wayward or outrageous happening can be corrected and fixed.
Absolutely. And more often than not, if you think about it, right, the pieces that we are automating as well are the ones that are more manual and admin in nature. So it's not really any critical health related kind of a setup.
Sure.
The health related setup always goes to a caregiver, which could be a doctor or a care coordinator with human in the loop who validate it and then take the action on top of it. Because the challenge of hallucinations are real. And again, like, because you're talking about healthcare and not you're dealing with a human life at the end of the day, like even 1% or 0.1% of the error is not acceptable. Like probably in the finance or like retail or whatever other world, you can still live with it. In healthcare, probably no. And that's why the human in the loop concept becomes so important.
So there's no room for error at all.
There is no room for error at all.
And Innovator has already factored that in.
Absolutely.
Terrific. Wonderful.
Yeah.
So we will talk about all the products and the might of what Sarah can do and the agents of health can do. I was about to say agents of change. But so they are agents of change, aren't they? I mean, they're completely transforming and redefining the paradigm of healthcare. But we'll talk about that later. But let's talk about this absolutely fascinating journey, Sandy. And I don't know if you know, and I don't know if I mentioned this to you earlier, but we have a few things in common. So I went to school in Lucknow.
Oh, wow.
Right? Lucknow, a small city for everybody who's tuned in, right, in India.
Yeah.
A beautiful city, though, which
It's a great,
with its own
it's
culture.
a foodie city.
There you go. How can you be from Lucknow and not talk about food, right? So you went to school there. You did your engineering from IIT, which is one of the premier institutions. And then you went on to another premier elite school, IIM Ahmedabad, for your MBA.
Yeah.
And from there on, I think how the three co-founders got together, and you may want to correct me if I'm wrong, you, Abhinav, and Kanav.
Yeah.
Was it Ingersoll Rand?
Yes, you
Right?
got it right. Yeah.
Okay. So talk to me a little bit more about how that journey happened. Was it so organic? Like, did it just happen, or did you guys make it happen?
So there are a few things to this, right? So post my MBA, joined Ingersoll Rand in this innovative program called Entrepreneur Program. And as a part of this program, we were supposed to come up with new business ideas for Ingersoll Rand itself. So that's where I got in touch with Abhinav, because I was taking the care of the GTM side of the equation.
Got it.
And Abhinav was on the product side of the same division that we were working on. So Ingersoll Rand otherwise is into heavy engineering. But what they were trying to come up was with this home automation solution.
Sure.
And something like that needs large quantum of data. So that's when we got introduced to this concept of data in the first time. And Abhinav was like also friends with Kanav. So that's how we three used to like, again, think a lot about that, what's happening and how we can like really think about data at scale.
So they were coming from IIT Kharagpur.
They were coming from IIT Kharagpur, and Abhinav was with me at Ingersoll Rand.
Right.
But like the three of us used to spend just a lot of time together, just brainstorming on ideas on what we could be doing.
Right.
And as they say, right, in any large organization, and especially in a multinational big organization, there are two things that people do the most. One is crib about the job a lot. And the second thing that they do is that, okay, what can we do together? So birds of the same feather flock together, and we came in together, and we got lucky that we got one of our kind of research projects back in the day. And this was a joint collaboration between Harvard and Wharton. And the project was all about that these researchers were trying to prove a correlation between all these like kind of Fortune organization, top 100, top 500, have got large access, or not access, but they've got a large kind of patent database. So they invest a lot in generating IP.
Right.
So the thing that they were trying to prove was that is the financial performance of these companies anyways correlated to the patents or let's say the IP that these organizations hold.
Sure.
So to run this analysis, they needed a huge amount of patents kind of database to bring in, financial performance to come in. Now, some very basic problems, right? Like something like IBM has got 200 parent-child kind of organization, because it will be IBM, GmbH, Germany, US, and some patent is held in some organization. So you have to do a parent-child mapping to bring all the data into a structured and standardized format.
Sure.
Now, this project, if it was being done manually, and this is a project in 2012, it would have taken still like 2 years probably of intense human labor and 30, 40 people to do it. When we got this project, we took this on, we deployed like whatever the tech was available at that time from a point of view of machine learning to bring this all data into a structured, standardized format and make it available for downstream analytics to be run.
So help me understand this. The three of you were on the same team?
We were on the same team.
Terrific. So, like they say, the universe was conspiring to make something bigger and larger happen.
Oh, for sure. And once we did that project, again, we realized that this is something that we really loved. We then left our jobs at Ingersoll Rand and just jumped into it. So a lot of time people are like, you know what, you must have had a great idea, amazing idea. And that's why in our case, it was different. It was like pretty much the three of us got just so that chemistry was so great, I would say, amongst the founders. It was like that, yes, guys, let's just do it. And we were 25 something. So did not have that concept of money and what have you. And like, again, having a good pedigree gives you a little bit of a comfort that come what may at a later point in time. So we left our jobs, jumped on this into a full-time kind of a gig. And very soon what we found was that once this research got published between Harvard and Wharton, we got a lot of inbound interest from all these professors across the country.
Right.
So think about from Wharton, MIT, Stanford, Berkeley, and like they were reaching out to us in terms of that, okay, can you help us also get this structured, standardized data in a research area of their interest? So for the first couple of years, 2013 to 15, we were just doing those. We did some 120 odd projects. We built up incredible ability to handle data at scale, bring it all together. But still, we were not making that much of money. Like we were like, again, we were in India. So like even $1 million, I would say was like
was a lot of
significant money.
And especially for 325-year-olds, right?
For 325, so it was still a lot of money.
You're
but
making a killing.
But it was a lot of fun that we had. So we were working 18 hours a day. We were sleeping in the offices, and like we had this. One story back in the day, we had a new batch of IDs come in, and we were still in the basement in Malviya Nagar in South Delhi, and they thought that they had joined some MNC or something, and they came in, and the three founders, one was lying on the left, right, and center, and they had to kick because it was all nighter for us, and we slept at 6 a.m. and these guys came in at 10. So the first thing they did was call up their parents and say that maybe we made a wrong decision or something. But one of those guys is now our SVP in the team, so did good.
Right.
But in hindsight, but those were fun days, I would say. So for us, one of the things that clicked a lot was the camaraderie that existed within the team.
Right.
So more than the idea itself, what we were doing, it was just, okay, we were having fun and we just started with that. Now, once we started with that, now 2015 time of like period, the realization started happening that, okay, this is not a very scalable kind of business, right? Because you're working with each of the researchers on a project by project kind of a setup. And that's when we raised our first angel round as well.
Okay.
And as a part of the angels, some of the folks that came in as a part of the team, they said that what you guys have developed over here with the ability to manage data at scale is something very unique. So they gave us the idea, and then we pivoted from, I would say, like your research world into the actual world, which was the enterprise world. And then 2015, as a part of that exercise, I was shipped from India to US is how I think.
So you were the first one, who made that move between the three of you?
Between the three of us. So I made a move and the ship landed, and that's why my number is still 201 in Jersey.
Okay.
And
you've retained that number? Is that the
I
number
still
I
retain
called?
that number.
Oh,
I still retain that number. So people are still like, okay, you aren't Babe, you're 201, but that's the story behind it. And then we started going industry agnostic, started as a horizontal layer platform. So finance, retail, and then healthcare was just one of the 4 or 5 verticals that we were in.
So before we get to that, right, because that is, an evolution in itself, and I want to talk to you a little bit about the rationale and as to how you arrived at healthcare.
Yeah.
And then obviously went deep into that domain, building capabilities. I want to talk about something that you alluded to earlier, that I think it was more the compatibility between the co-founders and the fact that you guys were having such a blast working together.
Yeah.
Right. That was more important as opposed to the target addressable market and how large and big and impactful the problem was.
Yeah.
So what's a piece of advice, Sandy, that you would give to our other early stage founders who are potentially looking for co-founders or building that team? I think, talk to me a little bit about what are those attributes and things they should keep in mind while building that team.
So it's the analogy that I give over there, always like an arranged marriage versus your love marriage kind of a setup. Finding a co-founder is as easy or tough as finding your life partner.
Right.
Pretty much, right? Like now what clicks? Why do you like someone? Why do you start okay, you figure out. Now, can arranged marriages work? Ask your parents. Like it did work, and it.
But you guys lived in. You guys lived in.
We lived in for a very long period of time. So
exactly.
we were not without the company as well. We just enjoyed each other's company because we would be playing something.
Right.
We would go evenings to do bowling and like a lot of fun that we guys used to have.
And you got to saw each other in action, right?
In
the
action.
Good, bad, ugly.
In action. And like everything came out of the front, and we just figured out that, okay, we like each other's company because either we were brainstorming on business ideas that, okay, what we could be doing. And we used to have huge fights, by the way. And that still retains, by the way. And I can like talk about it that amongst the co-founders.
Some things don't change.
We don't change. And like, because we are so passionate about our ideas, and that's what we feel brings the best out of us. Because at times if everyone is a yes guy around you or a yes man around you, what ends up happening is that you don't see the flaw in your own planning.
So how do you make decisions? Because I'm sure there are times when everybody's passionate about ideas coming from a certain place.
Yeah.
How do you then agree on something where you may not you may have differing viewpoints.
Over a period of time, we have now understood what's the speciality of each one of us. So, for example, when it comes to something around the GTM side of the equation, or let's say the customer side of the equation, typically, like, my gut is what the team trusts. So, like, everyone will have a different view that, no, you know what, this structure doesn't make sense. Have an account-based marketing or like account-based sales model. So I'll get the best of inputs, but like typically it's my decision and it's left as such.
And is it unsaid, or do you
It,
guys
it
have
is
that
kind
on-
of unsaid.
Okay.
It's always unsaid. Like,
You've never agreed on
we
this.
have never agreed, but we know that, oh, you know what, this dude, like, for example, Abhinav, when he will talk about the strategy part of it, the vision, we'll have like huge fights about it. But at the end of the day, we know, like, okay, you know what, this is one thing that he typically is right, and everyone has an off day and they're wrong, but you have to trust your kind of co-founder, partner, whatever you want to
It's
call
like in
it.
a marriage, deciding who does the laundry, who does the,
you have to go
cooking,
and plan for a trip.
who
You
does
left
the
your wife
errands
to it and like, okay, you know what, it's on you. And even if you land in the shit, you know that, okay, we are in it
We are
together,
in it
what
together.
to do.
Yeah.
So I think that camaraderie is just so important. Like, even when like there are so many founders, young founders come to me and talk to me about it, the first thing that I try to figure out is that, do you have a team? Because things will never go as per plan.
Right.
And when like the slightest of problem or the biggest of problem hits you, will you still be okay that, you know what, it's fine, it's okay,
Right.
we'll do better, this is the trough, we'll go to the higher point at some point in time, and you be happy with it.
Right. So the trust and the fact that you realize that you have complementing capabilities, the fact that you're ready to back each other and you enjoy each other's company.
The enjoying each other's company is the most important thing.
So, without spending way too much of time on this subject, but I think there's an important question which every founder has in their mind. Do you give yourself that opportunity to work with your co-founder on a real project with real consequences? Or could you just have a couple of meetups over coffee, look at the resume and, do some references or whatever that is, right? And decide, okay, let's start off.
That's again the question: love marriage versus arranged marriage. I'm a guy who did arranged marriage.
Right.
So I met my wife and she has helped me a lot throughout my life. But we met twice, thrice, and we were like, okay, we struck gold. We were like, okay, you know what, we like each other. And then, but like, again, any kind of a relationship, if you think about it, the work has to be done on both the sides of the equation. So I don't know whether it's a real project. If you think about it, if things click, they click.
They click, yeah.
And if they don't, then again, be quick about it and do something else and move on. Kind of
Fair
stuff
enough.
is what I would recommend. There is no exact science to it.
There's no science. Okay. You've got to back your instincts and you've got to be able to. Yeah. All right. Fair enough. So, you were about to talk about the fact as to how you got into healthcare because you were playing with data. You were solving data specific problems, right? But you had not identified which domain or which industry segment were you going to go after. So how did you arrive at healthcare? How did that happen?
So we went industry agnostic. When we went from research to enterprise and we came over here, we ended up meeting with a lot of prospects, I would rather say, a lot of prospects. We got some initial wins very quickly because our researchers, they helped us get those meetings and the credibility came in instantly.
And which year was this? 2015, did you say?
This was 2015.
2015.
So 2015, we came here and I still remember I landed in Boston, and that I think 2015 in Boston was the coldest year, I think in 20 years or something like that. And the night I stayed in over there, the next day the car in front of me was totally immersed in snow. It wasn't to be seen. I was like, dude, I'm running out of here. So lots of running stories at that point in time. And we used to be still not funded by any external kind of entity. So it was all organic. So staying in those $15 a day kind of rooms and like living through $20. So like, but the best memories are from that day. But coming back to the question that you asked about healthcare specifically, right? So we ended up getting customers like Walters Kluwer's, Bank of America, Disney. So some very prestigious, large customers, so to say. And the thesis was again the same, that data is in silos, we'll bring it all together. If we would have continued on the thesis, that was a path to be a Palantir, or let's say call it a Databricks, or call it like a Snowflake. So again, the world is endless. But so that's a positive side of the story, that if we had continued, but then there are a lot of negatives as well, right? Like a lot of companies that you would have never heard, that they just die because they end up being a consulting kind of a firm, right? So industry agnostic, we got customers, but the challenge that we started facing was that these customers were asking us to solve business problems for them, right? So either the question was that you remain as a data layer kind of a company, or you add a consulting layer. But as 27, 25-year-old, again, that was not something that we had seen, that we could build up a consulting org around it. or you choose one of the markets and then go very deep into it and develop that expertise in-house.
Sure.
So that's when in 2016, mid 2016, we made the hard decision. And the hard decision was that, guys, you know what? Let's leave 80-90% of the revenue on the table. We already had got to $8 to $10 million, so which is a fairly fast kind of a growth. But from $8 to $10 million, we dropped down to $1 million. And that was the hardest decision for us to make.
How did you justify it to the investors?
So that's a
said that
funny
you had a
story.
bunch of angel investors,
Yeah,
right?
so we had just raised Series A. So we had raised Series A in Q4 of 2015. Q4 of 2015. So we had moved over here. We had got the customers. We raised the fund.
At that point in time, all three of you were here, or was it just like back
Just
and
it
forth?
was me. I had moved over here, and like Abhinav and Kana were doing back and forth.
And were you still in Boston, or
So I was in New York.
Okay,
I
you
was
were
in New York because the customers were also so like Bank of America, Baltus Kluwer, they were based in Jersey.
So it made logical sense.
So we were just closest to the customer kind of a setup. Yeah, so we raised the fund in Q4, and then Q1 we told them that okay, we are shutting it down. It was not too much of a discussion, frankly. Our investors were a little bit shocked at that decision.
I'm
like
sure,
they
yeah.
supported us a lot, without a doubt, because they saw that, okay, you know what, the opportunity over here is to build a multi-billion-dollar kind of an organization. And they saw that there is like I think that like now being on the other side, when I'm investing in other companies, you get to see that passion in your invested organization.
So how much of that was gut? How much of that was data backed?
It was a lot of gut. Like again, the data back part of this was that, okay, healthcare is a big market. And we just got one customer in the middle of nowhere in Iowa, which was erstwhile CHI Iowa. Now is Common Spirit. By the way, we are still a customer. So our first customer is still a customer. They just signed on for another 5 years last year.
That is incredible.
So again, customer success.
They get the best deals, right? They get the best deals, best discounts.
I'll not say that on camera. But the point is that that decision was just on the point, like, and as again 20 something, you don't use healthcare so much, so it's not that we really appreciated the problem, and there was no personal story around it.
Especially healthcare in the US. I mean, it's
Yeah.
been 11 years. I still don't understand my healthcare bills. What is copay? What is deductible? It drives me nuts. So from India, two co-founders still in India, you've just been here for a year and a half,
Yeah.
to decide to solve for healthcare problem in the US.
It just felt like that. So our decision was based on this, that when we did the secondary research, it's a big problem for sure. Healthcare seemed to be and is yet the highest untapped market.
Sure.
And we just decided to take a plunge, and then we fired our other customers that were there. And that was an interesting story. When we showed up in our board meeting, our board was like, you should have sold that business. And like, yeah, probably. But like in hindsight, again, if you try to sell something to someone, then they want to retain you and they want to do so much kind of acco hire and stuff. So good decision in terms of that. From that $1 million in 2016 mid, now we will be ending this year at, let's say, a couple of 100 million plus in rev. So like 2017 to 2025, an 8-year kind of a ramp up kind of a journey. But it was all a lot about, I would say, data is always there. You know what's happening in the market at a but trust your guts. And like your co-founders, if they are in it with you together, you are just relying on the fact that if you screw up, they screwed up too. So you are not alone in it. There is some comfort in failure.
So at that point in time, once that decision was made, then Innovacer, as we know it and see it today, came into being. You became a healthcare data company. The intelligent bit obviously got added later, right? As technology came of age and AI and machine learning and all of these different things. All right. So now that happened, talk to me about the first few years, right, of you solving for the first few problems in healthcare, and how did you then scale from there?
Sure. So this was again 2016. So the first customer I was talking to you about, they were trying to create this clinically integrated network, which is all about that you have to aggregate a lot of data. So the first problem that we were solving for was that healthcare still has, and even so more earlier, all these data silos that exist. For example, think of this as a story of the classic story of the 6 blind men in a room with an elephant and everyone trying to touch and trying to figure out what the problem is.
That's a perfect analogy.
Healthcare has that same problem. So you might have 2 primary care and 3 specialists trying to figure out the patient, and because they don't get the holistic data, or worse off, they end up doing replicated kind of tests across the board, because of which your utilization is so high and your cost of healthcare keeps on increasing, which is like fun for no one, so to say, right? So the first part of the problem that we were trying to solve for was, okay, bring the ability to bring all the data together. Now, from our experience of working with, I would say, academia or research, where we were anyways doing this problem at scale, this came in very naturally for us. That, like I told you about the IBM example, that so many iterations, and that was the first project we did in the research world.
Yes.
Similarly, over here, the biggest problem was that, okay, let's say Sandy Gupta will exist as Sandy Gupta, will exist as SK Gupta. So different kind of names and like the
Duplicate
simple
records and-
duplicate records, and like again in different kind of, because you could be in your own within network, you could be out of network, you could be traveling, and then it could be a lab, it could be a pharmacy, it could be something to do with claims, it could be clinical. So ability to bring all this data together into that, call it unified patient record, a golden record, if you will, that was the first part of the problem that we solved. I think that became the real scalable kind of thing for us.
So back then, did you have a lot of these patient portals as we see it today, EHR systems, where you would still have, your lab work would come in and that's an external provider and then something else would come in from somewhere. Did you have all of that? Or
So EHRs have been in existence for the
For a
last
long
2
time.
decades.
Okay,
So the
yeah.
system of records has been there, but the system of records was always kind of disparate and distributed. So the
That makes
first
sense.
problem is that bring all the system of records together to create a unified patient record.
Sure.
So once that data is solved, then you get to the system of intelligence part of it. So the system of intelligence, because unless you have like it's a garbage in, garbage out, right? So if you have a high quality kind of a data in, you cannot run any analytics, any insights, any intelligence on top of it. So that became the second part of the problem. And that we focused in then very specific areas and challenges that healthcare was facing. So healthcare had a challenge of moving into value-based care, for example. And this we picked up as a problem area in 2018. So we picked up in 2018. So first 2 years, I would say 2016 to 2017, and we were solving the data side of it, where we build up a lot of pre-built connectors that we will now bring data, do the ETL processes, bring it into a structured and standardized format.
So at that point in time, you were already connected with, say, a Epic or a Cerner, and all of these different integrations were already built.
So yeah, so that's the period when we really build them out.
Sure.
So that's the part when we started telling the market that we have these pre-built connectors, we'll do high quality data fidelity kind of transfers and bring it all into this structured and standardized format. 2018, then
Did you have the ability to bring in multimodal data, right? Text, video, all that?
Sure. For not so much video. Like again, it's all about text and some kind of imaging data that you will bring in, not video, even as on date. That's no use cases are not that prevalent in healthcare. So bring that data in and then develop the intelligence on top of it. The intelligence part of it is then we started going deep into the value-based care kind of aspect, and value-based care focused on population health. The moment we launched it in 2018, by the end of 2019, there is something which is called as a KLAS, class rating. It's equivalent of, call it a Gartner that
Right.
you would see otherwise.
And you won 5 times since, I think,
2019 is the first time.
And you're the only ones.
Yeah. So the market was also like, even our customers and prospects was like, this is a newbie company, just 2 years old. How could they even get it? Because like the folks who were class number one were like likes of Epic and Cerner, which had been in the business for 20 years and 30 years.
So the new kids on the block were giving everybody a run for their money.
So the reason for it was that we had solved the data part of the equation, because everyone was trying to figure out the analytics part of the problem, but analytics is only as good as your data is. Because we came in as a data first company, most of the healthcare, the problem was that everyone was looking at the use cases, and for a specific use case, they were trying to figure out what kind of data needs to come in. So in a way, it was a late binding kind of a concept. We came in with a concept of early binding, which was that, okay, we'll solve the data problem first. And if that is sorted out, then any kind of analytics and use cases accordingly made sense. So it was looking at the problem with a different lens, which we were not aware that we were looking, but we were looking at it anyways.
It's interesting you talk about, value-based care and your focus in that space, which centers around patient outcomes and patient experiences. And obviously the pricing model, you may want to correct me if I'm wrong, is different. It's not pay per visit. There are different models, right? You could have savings based or bundled pricing, or looking at the overall outcome for the patient. How prevalent is all of that, Sandy? So when I look at my visits, right, when I go to a specialist or, to my PCP, I'm yet to see, a bundled pricing where somebody is looking at my outcome saying, hey, if Peeyush has a certain condition, how are we treating that? And then I still get, my bills are per visit, and it just drives me bonkers. So where do we get to see the value-based care? Is it more in Medicare? And
So no. So you, as a patient, you don't get to see it. You see it at a provider level or at an insurer level. Because if
Okay.
you think about the US healthcare is all about that. It's all an insurance driven kind of a setup. You as a consumer are paying to the insurance company, which
Which
is
is
taking
reimbursed.
the risk on your behalf.
Sure.
Now, earlier the risk was owned just at a insurer level, and all the visits between you and your provider or your doc were happening on a per visit fee for service kind of a basis, right? And that's the record that you see.
Right.
And the provider was also just billing on a per billing kind of a basis or a per visit kind of a basis. Now that risk is moving from the insurer to the provider. And what that means is that the provider, for example, when you go and visit, maybe they get, call it $100 and just making up numbers, $100 per visit. But if they did a good job at it, now how do you measure a good job is that, let's say you do not have a readmission. It is measured by, you know what, your HbA1c actually goes down, or some of the challenges that you are facing are not recurrent in nature. If that ends up happening, then automatically they get an additional bonus attached.
How objective are these metrics based on which, a pair would decide?
They are extremely objective.
They're very objective.
They are very, very objective. And that's like the analytics layer that we build. These could be on the area of cost, quality, utilization, risk. And the entire thematic of value-based care is that 80% of your cost is because of 20% of the patient. That's true for any given kind of a setup. So you figure out the highest risk 20% of the patient. You do a lot of preventative care around them, because if you can bring them down the cost curve with high quality, that's where you have bent the total cost that the economy was facing.
The other thing I wanted to talk about, and I was intrigued to read about this as part of value-based care, you're also in the industry is looking at social demographics, right? Saying, looking at the demographics data, can you be more proactive in terms of either recommending a certain, preventative treatment or whatever that may be? Again, that is something I don't get to see in my day-to-day. I mean, I'm a man of South Asian origin.
Yeah.
Typically, you would associate things like hypertension and hyperglycemia and things like that, in my kind of age group.
Yeah.
I've never had a provider reach out to me saying, hey, you are 40, you should be doing ABC.
Ideally, that should be happening. It depends on which system you are working with, but that is the intent, that's where healthcare should be guided towards.
So let me ask you this, and
Yeah.
let me put you on a spot here.
Sure.
How screwed was healthcare when you first got into this, when you decided you're going to be solving for these different problems,
Sure.
to where it is today?
So, two parts of it, right? I can, with confidence, say that the data part of the problem is pretty much solved. That the data, like the easiest part of thing, like for example, you going into, for example, hopefully not for yourself, but let's say for some like person that if they had to go into a healthcare facility, they would have to fill up the form every time. That I'm going to, let's say, a primary care, now I'm going to a specialist, now I'm going to a super specialist, whatever that was there. Every time you would have to relate out the entire kind of challenges, issues, and your entire history at all point in time, because the interoperability layer did not exist. That is now a problem that is pretty much, I would say, 90% solved.
So you know your patient, like how banks know their customers.
So
you
you
know your
walk in
patients, yeah.
anywhere, if you are going within the network, or let's say within the same kind of, let's say, health system, then they would know exactly who you are. So the problems are very clearly. So that part of the problem is solved. I think where the world is now going towards is a preventative care and more kind of insights in the point of care in terms of what is the next best action that needs to be done with the patient. That is what is now, because even from an evolution perspective, it's the data first, then it's the intelligence, and then it's call it the layer of engagement. So you have the data layer, intelligence layer, and the engagement layer. The last two layer is where healthcare is now moving towards. And with this advent of all the things around AI and like convergence, this is now getting much better fast tracked. Because for the first time in healthcare, rather than you going to convince the systems are now coming to you and saying that, okay, are there some interesting solutions in this area? We are hearing X, Y, and Z. What do you have? So the ability of the market to adopt a newer solution in this area is getting better and better.
It's interesting you say that. And I was reading a report by McKinsey that was published recently where they talk about the revenue growth for healthcare technology services, segment, which is expected to grow up by 8% CAGR between 2023 to 28. The other interesting thing that I found in that report was that if you look at the overall, EBITDA as a percentage of total expenditure in healthcare, that has been under a lot of pressure since 2019. I think it said it's probably gone down by 150 basis points if I get it right. So talk to me a little bit about healthcare industry at a macro level, the shifts and the trends
Yeah.
that we are seeing, Sandy?
You see, highest level, if you look from a 2020 kind of a perspective, right? And interesting, you bring up the EBITDA point. The cost of delivering healthcare has been going up because the cost of resources is not reducing. So the reimbursement rate for most of these healthcare ecosystem, even if they are growing, let's say at 5%, 6% in tandem with, let's say, your inflation, just the cost of delivering care within healthcare has been rising at the rate of 10 to 12%. So what that automatically means is that from a CFO perspective, your EBITDA is under serious pressure.
Right.
And that's the reason why you are seeing so much of consolidation and mergers and acquisition which are happening in this space.
Yeah.
So
And you made an acquisition recently, right? I mean,
Yeah. So-
in January. Cured is the company
Yeah, so that was in the area of actuarial analytics, because for our customers now we can start predicting that, okay, you know what, looking at the history of a patient, we can start predicting that what will be the cost of care or delivering care to this particular patient. So that's an intelligence we did not have on a platform. So that's the one acquisition that we did. But even on the M&A point, right, these M&As are happening at a macro level between these large health systems. So if you looked at the recent report, like Risent got launched through Kaiser Permanente, and like Risent has acquired what? They acquired Geisinger, they acquired Cone Health. They made a public kind of a declaration that they would be doing 3 to 5 more acquisitions over the next 3 years. So this is getting a market where consolidation is going to be very key, because the pressures on the EBITDA are very rare. Unless they deploy a lot of these agents of care. Now, that's my spiel.
agents of change and agents of
Yeah,
care.
because like if you think about it, if your healthcare delivery cost is increasing, the reason is that, you know what, the nurse that used to be at X dollars, let's say per hour in 2015, 2019, now is probably 3X.
Right.
So you need to reduce your reliance on manpower to some level by automating it and using AI. Now AI is also used to be a buzzword, but it's also a little bit of a word that's now getting on a, so it's more of automation if you think about it. You don't really need that much of, and most of these health systems are also facing a huge shortage of the right manpower in the first place. So if you reduce their reliance on humans for some of the tasks on the administrative side, which can be taken care of before the actual doctor sees the patient, that means your cost of care reduces and your EBITDA automatically goes up.
And you're attacking it at multiple, in multiple ways through Sarah,
Yeah.
which is a co-pilot, right?
Yeah.
So how are you able to make your agents more effective,
Yep.
reduce the call handling time, improve the call resolution rate, and then using your AI agents
Absolutely.
as well.
Yep.
Okay. So at this point, Sandy, I mean, what is the outlook for, what is your vision, and what is the vision that you as co-founders and the founding team at Innovator have for the next 3 or 5 years?
So, we are in a very interesting time within healthcare. For the first time, it feels like that healthcare has always been a little bit of a challenge because the adoption curve has been very, very long. And for the right reasons. You are dealing with the health of the patient. So what has been working in the past need to work in the future as well. But we are seeing a much faster adoption cycle in healthcare. And that being said, the kind of opportunities that are there in terms of the transformation that you can bring about is very significant. So from our perspective, if I in plain revenue terms, if I think about, we are estimating a growth of almost like 5x to 6x in the next 4 years to 5 years. And
That is
that's at the
phenomenal.
pace at which we are.
That is phenomenal.
So again, that's the kind of growth that we are anticipating that should happen over the next period. But more importantly, like we measure almost religiously the outcomes that our customers are getting by using a platform. So we just did this, like the customers got around a 10x, 9x to 10x kind of an outcome for every dollar, for example, that they invested with us, they got around $9 to a $10 kind of a return. We are estimating that they should be able to get to a 14 to 15x kind of a return on every dollar that they're. So we are
That is
increasing
impactful.
our
Yeah.
revenue, but the more important thing is that the outcomes that we are able to generate for our customers will increase at a factor which is higher than the increase of the company's kind of like growth itself. So
And that's where the
it'll
real
be-
impact is.
Exactly. So that's the win-win kind of a scenario that you create for your customers and for yourselves. So yeah, it's a very, very interesting time.
So I'm intrigued at this point in time, like how many hospital systems do you work with? I read somewhere that I think you work with 6 of the top 10 already.
So 6 of the top 10. 110 enterprise customer like Kaiser Permanente is just one of them. Then there is Ascension, there is Trinity. So these are very large health systems that we are talking about. So 110 enterprise customers and roughly 75 million plus lives on the platform. So if you think about it, 1 in 4 Americans is already on the platform in terms of the data that is flowing through the systems. The thing is that we are not able to provide intelligence on each one of them because obviously each of the hospital systems use us in a different way. They definitely use us as a data platform and definitely use us for the value-based care aspect of it. But then there is so much more analytics, insights, both on the outpatient, inpatient side that they can leverage us for. And that's the journey that we are looking to fulfill. If I look at my penetration rate with my customers, that's roughly 33% today. So if we stopped selling anything and just retained the customers, which touchwood we should, we will be 3x the size in 3 years time frame just because of the penetration of the products that we have with the customers.
That is super powerful. And you know, I have to ask you this. Where are we going with all of this? Are we going to be seeing that, in front of us in the next 3 or 5 years where your basic PCPs would be redundant almost? I mean, I was just looking at some of the things that the agents of care can do and what Sarah can do.
Yeah.
How close are we to reaching that point where 80 to 90% of what your general physicians and family care physicians are doing, you would have an AI agent doing that?
Sure. I think there will be a scenario. See, there is a huge shortage in the primary care or let's say the specialist world, not just in the US, across the world. There is not enough doctors that you can have. So I don't think it will be as much as a demand problem as much as a supply problem. So first of all, you need to augment the lack or the shortage of
So
docs
it's not
that you have.
replacement, it's augment.
It's an
it's
augmentation.
augmenting,
So the future that we hold is like, for most of the docs, if you like even talk to any one of them, they would be like that, I really want to look in the white of the eye of my patient and then treat their problem. Because if you think about it, when you are as a doc, and a lot of my family members are docs, so like for them as well.
Do they see you as a threat?
But the point is that for them, the human connection is the most important thing. A lot of times, because your doctor maybe gave you a white powder, you just ate it and you feel well because you trust the person in front of you who's giving you that medicine, right? The point I'm trying to make is that with the advent of EHRs, with the computer, they were not able to do that human connection part of it because they were into the computer typing while, let's say, you are as a patient telling them the problem. The future that we unfold is that for a problem which is real and you are really perturbed as a patient, because for the smaller things, there is always going to be some agent that will take care of you. Because let's say if you want to ask for your child that, hey, you know what, got fever, okay, give them Tylenol and that's all good. But for the patient that is having a real problem, you walk up to your PCP without looking at any kind of a screen. They can look in the white of the eye and really understand the problems. They can do the right diagnosis. They can get all alternate kind of suggestions in terms of like, maybe you should recommend X, Y, or Z, because to your point that you were saying around the demographics that, hey, this is a South Asian, like male 35, 40, and like these are the probabilistic things looking at his history and similar phenotypes that exist with other patients. Probably you should recommend X, Y, or Z, and then the doctor takes a call on it and recommends that to you. We don't envisage a future where the docs won't be there, but they will be highly, highly kind of, let's say, call it supercharged or superpowered.
So it's already a lot more powerful than just automating note taking,
for
that
sure.
next best action.
Yeah.
We are already talking about AI making inroads in diagnostics in a big way.
For sure. Yeah.
All right. So, Andy, there's plenty to talk about. I mean, this is so intriguing as a subject because this hits everybody. I mean, this is so relatable. But at this point, I want to pivot to talking about another very important element of building a company and a large enterprise and, a respectable organization. And that is your people. I was absolutely intrigued when I looked at your data. First of all, compliments to you. The attrition is low and you've been obviously adding to the team. But one thing I was intrigued to see was the number of people you've been able to attract from the Ivy Leagues and from the most premier, institutions worldwide. And I'm not just talking about Harvard and Stanford and the Berkeleys, but even back in India, IITs and the IIMs. What's your talent strategy? I mean, what is the hook, right? And how do you continue to attract and retain such top talent?
See, like as a leader, being truthful and being direct with the team helps. So showing up in a consistent way is the most important kind of thing. Obviously, like if the company is growing, you are getting the right funding, so you get the right surround kind of sound. that helps you. But the word spreads if, as a leadership, you're not treating your talent the right way. And if you treat them the right way, then people again get to know that, okay, this is a place that they can call it home and they want to stay with you. It's very simple. Like, I'll give you a simple example. The teams with the highest attrition is typically your sales team, because you hit your quota, now you don't have visibility for the next year, so you decide to move on, or you are anyways not hitting your quota, so then you will decide to move on. Like in our case, our average tenure of a seller in the team is roughly around 5.5 years or something like that.
That is
And that's for a company just 8 years old. And
That
the
is
reason for that
incredible.
is that we put a bet on the ethics of the person as a seller. Because, for example, when I have to judge a seller's performance, it's much more about that: are they working hard? Are they doing better than anyone else could have done? If that's the case, then results will come.
And how long are the sales cycles? I'm assuming these are fairly
18,
long sales
18
cycles.
months sales
18
cycle.
to 24 months.
These are long sales cycles. So you need to have patience, but then you also need to trust and take a bet on the right person. Because if you trust somebody, like for me, that ends up being the most important thing, that like, okay, you know what, this guy is doing better than anyone else, or myself included. Once I can be trust, then like you just let them be. And I'm sure everyone wants to hit their numbers. Everyone wants to like overachieve whatever goals, OKRs that you're given. It ends up happening.
So do you still take the time out? Do you and your other co-founders still take the time out to interview some of your sellers or other people who are being recruited?
Always. There is not a single person who gets hired without the company, without one of us talking to them.
And how often and how frequently would you find yourself talking to Abhinav about who you want to be as as an organization in terms of your cultural tenets? And help me spell that, if you could spell that out a little bit, right? What are your key cultural tenets?
Yeah. So like, again, a few things which are very, very important to us. I told about this, right? Like our first customer is still a customer that will continue for the next 5 years. I think having a obsession for your customer is extremely, extremely important. And it's not just like a comment that you write on a wall and then hope that everyone, like, the customer thing has to be that, okay, if there is a problem that is there with the customer, all of you jump on it and solve it. This rating organization that I was talking about, Class, right? Class did this survey amongst our customers to say that, okay, tell us the one trait that stands out about Innovacer. And they said that just the obsession that their company has with customer success is something that keeping 100% of their promises, for example, is one of them. Or like showing up when they are having a trouble or a problem.
Talk to me about a time when you were not able to keep your promise, because you keep it most times.
Sure.
So is there a time that stands out?
There have been times, like, again, healthcare is a very complex area. So I remember still like the first pediatric customer we got, 2018, and we were working with Medicare customers. So again, the profile of patients is very different, 65 plus versus over here you are dealing with newborns to, let's say, up to 13 or 15 age, right? So we thought that we got the right analytics in, because but what we did not realize was the nuances in the data. So this is a 2018 customer, and the customer name was actually Pediatric Associates. I still remember them.
Nice.
With them, the challenge ended up happening was that we thought that we had cracked the analytics part of it when we actually hadn't. And we tried very hard, but our data model was not shaping out the right way. And we had to go and, like, again, tell them that we are not able to do it. We ended up churning that customer. The good part of the story, though, is that we regained the customer again in 2022. So after 4 years, and now they're an extremely happy customer.
So did you celebrate? Did you have a major homecoming party?
Absolutely. Like nothing like getting your churn customer back. But if
yeah.
you think about it, that's how the customers trust us as well. Like transparency is so much of a key that at times, like, the Silicon Valley culture ends up being that, okay, you know what, fake it till you make it and all that kind of statement. But it's all about your transparency. If you are so transparent that you can go and tell your customer that, okay, this is an area that we've still not figured out, because of which they had to let you go. They know the reason and you know the reason, because then when you are ready, when you go back to them and say that now we will do the same thing what we had promised, they know you and they trust you. So this is just such a confined kind of a market and a space that showing up the right way and being transparent, like, is extremely important. So you talked about the cultural tenets, right? One was customer success, that placed them at the center. Anyone and everyone jumps at it whenever there is a need. And then second one is around the transparency aspect of it. The transparency that I was just talking about, that you have to be transparent, not just like absolutely yes within the company, but even with your customers, even with your investors, so that everyone knows that what is happening, what's not happening. everyone knows that there will be some issues, but it's about that how do you show up when there's an issue.
So oversharing is caring. What's that one real tough decision you and the other leadership team members have had to make in the last 18 to 24 months? And the reason I ask that question is we've seen bloodbath around us, right, during the great tech layoffs when companies have had to let go some of their most capable and most motivated people. Talk to me about what's been the toughest decision for you as a founding as a leadership team.
So there have been a lot of tough decisions, but the one that you just referenced, right, like this 2022, 2023 kind of a time period.
Brutal.
Because 2022, the talk of the town was just about that how much money you could spend and how much money you could burn. Like, again, an interesting anecdote over there. I was in an investor meeting, and I'll not name who they were, but the burn that got told to the investor was a little bit lower. And that got put back on the founder saying that, okay, your ambition levels are lower.
Oh, is it?
So your valuation of the company got determined by how much money you were burning. Because let's say if you are burning over the next 24 months, 36 months, something like $500 million, then obviously your valuation will have to be $2 billion because they want to have a 25% stake. But rather than a business plan and the appreciation around it, it was more about the burn. So the point that I'm trying to make was 2020 to 2022 was all about that more you burn, the better you are. And 2023 was a hard kind of reality check for everyone that, okay, you know what, now it's all about EBITDA and it's about cash flow and like how do you manage money. I think that was just a very interesting learning curve for our entire leadership team. Because right from going from the logic of growth at all cost, the idea became that, okay, you know what, balanced growth is the name of the game.
So the focus was on profitability as well.
Yeah. So the rule of 40 became a real thing that,
Right.
okay, you know what, it just cannot be growth at all costs, but you have to bring it in a way that makes most sense. And that kind of learning, relearning, and then activating it was a very, very painful process, which we did it in a matter of like 3 months, kind of an exercise. We had to let go of some incredible talent, never easy. But I think in hindsight, it was the best and the right thing to do.
Okay, so let's have let's put you through a rapid fire round. So one thing in your journey since 2012 that you wish you had done differently.
Got it into healthcare earlier.
Straight off the bat, right?
Yeah, like verticalization helps you. Like, again, you can be an agnostic kind of layer, and in today's like time and environment where you could be an agent, an AI solution, and you can build up because your entry barriers are getting reduced a lot because of everything that AI does for you. Like today, a coding which used to take, let's say, 6 months can be done in a matter of 5 days, 6 days kind of a setup. So time to develop is compressing. And in that, the subject matter expertise then automatically comes with a verticalization kind of a strategy. So I'm a firm believer in the vertical kind of specialization part of it. It helps you grow larger and quicker once you have cracked the game. But I'm sure that different things work for everyone.
So and one decision that makes Innovator, the company it is today.
The point is that we have been very agile as an organization. Like the number of pivots that we have made is like from research going to agnostic to healthcare. Within healthcare as well, we thought it was payer, no, like sell provider. Within provider, we thought we'll sell data platform. That's not sticking. Sell value-based care. Within value-based care, then okay, let's go to. So I think the ability to decide quickly and then move fast is the most important thing. That is something like I personally call as the Brownian motion of success.
And is that one of your cultural tenets? Is that what you look for in your prospective hires?
Important. Like you get a senior exec from somewhere and they're like, you know what, we need to have a full 5-year roadmap and a strategy of how this will be. And I'll take a 3-6 months kind of a thing that how will you launch it, and we'll do some studies and this, that, and everything else. And we're like, no, that won't work. Have an initial thesis. 24 hours is what you get.
Right.
Decide, figure out, because you learn by executing and by failing. It's almost that, okay, I did this today, I failed, okay, let me do something else. So you do the zigzag motion so much that eventually you strike what works. And if you look in a time period, because like the time compounding is very real, the zigzag motion eventually gets you to that funnel of moving forward and upward. But we are a firm believer of just trying out stuff and then seeing what works. So To answer your question, it's the ability to think on the point and make decisions, and then agility is the key.
That is absolutely phenomenal. Any piece of advice that you would want to give our early stage founders, right, who've just gotten started on, on this journey, or even to those who are, sitting pretty in their cushy corporate jobs, but they're bitten by the entrepreneurial bug and they're contemplating as to whether to take the plunge or not. What piece of advice would you want to give them?
For me, the one thing which is always been and I've talked a lot about it in the earlier part, right, is the team camaraderie. Have a set of team that you can like really trust and you enjoy working with. If that piece takes some time, that is time well spent. And I get it that with AI and everything, it feels like, hey, you know what, the world is moving so fast, and if you don't get on the back end, then you have lost it. But the thing also is that there is always such time. Like in my own kind of last 2 decades, if I look since 2005, 2008 kind of a time period, since I got into BTech, and there was always something that was coming along that you could get on and you could make it very, very big. And whatever you start with is not ever going to be the thing that you become big with. You are going to do multiple pivots. Absolutely. Like rarely you will find, and I'm sure there are, but like that percentage will be small of companies that started with a thesis and just scaled up that, because you're going to iterate over a period of time. The only thing that holds good at that time is your team. Having comfort in like your folks, in your your founders, and it might not be your founders, but the founding team. Like what is the initial set of 5 to 10 people that you have a lot of fun with? If that piece you have cracked, other things hopefully will fall in place.
That is absolutely wonderful. And I'm pretty certain that everybody who's tuned in and listening to and watching us would definitely take a leaf out of your book, and it would help them tremendously. One last question, Sandy. Have you ever had a sales kickoff or your, annual meeting in Lucknow where you've treated the team to tunde kebabs and
one of these days for sure. But yeah, actually the funny thing is that 2 out of 3, Abhinav is from Lucknow, I am from Lucknow.
Oh, Abhinav is from Lucknow as well.
My CTO and my founding team member Ankit, he's from Lucknow. So a lot of us are Lucknowites. So yeah, we have fun time eating together. So yeah.
That is wonderful. Sandy, thank you so much for talking to us with so much of candor and for being who you are, and for making it very, very real and relatable.
Oh, this was great.
It was a pleasure having you on the show.
Same here.
If you're listening to us on Spotify, Amazon, or Apple, if you like the content and what we're talking about, please go and hit those 5 stars and leave us a review. That goes a long way. And if you're watching us on YouTube, then please like and subscribe. And that way you can be absolutely assured that our content reaches you and we follow you along, our journey. And we hope to bring to you more founders, more ecosystem builders to talk about their scale-up pursuits.
Thank you for flying with the Scale Up Flight. We hope you'll join us again soon.